Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
classification of antiarrhythmic agents. So this is actually according to the Vaughan William Singh classification 1988. According to this Vaughan William Singh classification 1988, he has divided the antiarrhythmics mainly into the four classes. Class 1. Class 1 is a sodium channel blocker. So these are class 1A. Class 1A include we have quinidine, procainamide, disopyramide. So these are class 1A blockers. Then we have class 1B. Class 1B include lidocaine, phenytoin, tocainide and mexiletine are the 1B. 1B are lidocaine, phenytoin, tocainide and mexiletine are the class 1B drugs. Then we have class 1C drugs which are echinide, flecainide, propafenone, morphine. So these are the class 1C drugs which are echinide, flecainide, propafenone and morphine. Then we have class 2 drugs. Class 2 drugs are actually beta blockers. The beta blockers which are used in arrhythmias are we can use metoprolol, drugs like propranolol and esmolol are used for arrhythmias as antiarrhythmics. Then we have the third class which is class 3. The class 3 antiarrhythmics are actually potassium channel blockers. So these class 3 antiarrhythmics are potassium channel blockers. These include amiodarone, bretylium. These are amiodarone, bretylium. Then we have dofetilide, dofetilide. We have dronadiron, and we have ibutilide. Then dofetilide and ibutilide. Then we have drugs like verinacalant, and we also have one more which is sotalol. Sotalol is actually a beta blocker, but it also has a potassium channel blocking property is also seen. Then the next class is class 4. Class 4 is calcium channel blockers. So calcium channel blockers which are useful are verapamil can be used for antiarrhythmic and diltiazem can also be used as antiarrhythmic. Then we have class 5. Class 5 mainly contains the miscellaneous drugs. The miscellaneous drugs of class 5 are we have potassium, adenosine is present, then digoxin, atropine and magnesium are the miscellaneous drugs which are present.
thank you and thank you for watching.